Welcome back to Parasitology. In the following lectures, we will be covering the nematodes, which are also known as the roundworms. As I mentioned before, the first major topic of parasites we will cover are the helminths, which are the worms. The second major category are the protozoans. So starting with the helminths, I have a reminder about the categories of the different helminths we will talk about. So there's two main phylums, the nemat helminths and the platyhelminths. Of the nemat helminths, the only class we'll be talking about are the nematodes, which are the roundworms. And these are the first set of lectures. They are focused on the roundworms. And they're named because in a cross section they have a round body, as opposed to the flatworms or the platyhelminths. So there are two categories of flatworms, the cestodes and the trematodes. Remember, the cestodes are also known as the tapeworms, and they have segmented bodies. They're flattened with segmented bodies. Remember, I referred to the piece of Scotch tape and the different proglottids. Then the trematodes are also known as the flukes. They have flattened bodies and they have leaf-shaped cross sections. They are non-segmented. So starting with the roundworms, there's intestinal roundworms, blood roundworms, and tissue roundworms. We will not be discussing the ones that live in the blood. So for this course, we're only focusing on the intestinal ones and then one tissue roundworm. Of all the helminths, these are the most common in the U.S. They possess two separate sexes, so there's always going to be a male and a female form. The transmission is of several ways. There's some parasites you ingest the infective egg, some have larval penetration of the skin, or ingesting larvae. So we'll talk about each one individually. Here is our roadmap for all of the roundworms. You need to know both the scientific name and the common name when applicable. You will have to know how to spell all of these words, so get to practicing. And the only way to be able to spell it is to be able to say it. So you might feel crazy talking to yourself out loud in the library or at home, saying these things out loud over and over again, but it's just like learning Spanish or another language is to practice saying it. And of course, there's more than one way to say it. I will be pronouncing these words the way I was taught, but I know there's other ways to pronounce them too. So we'll go ahead and start practicing. The first one we'll be talking about is Enterobius vermicularis, also known as the pinworm. Then Trichuris trichiura, also known as the whipworm. Ascaris lumbricoides, also known as the large intestinal roundworm. Strongyloides stercoralis, also known as the threadworm. Trichinella spiralis is in red, and it's unique because you'll notice there is no common name for it. So you just need to know Trichinella spiralis. And it's also unique because it's not an intestinal roundworm. It's our one tissue roundworm. So more on that later. Then we have Necator americanus, also known as the New World hookworm, and then Ancylostoma duodenale, also known as the Old World hookworm. So we have two hookworms. Starting with Enterobius vermicularis, also known as the pinworm. This is worth talking about first because it is the most common helminth infection in the United States, with about 20 to 40 million people infected, which is about 10% of our population. Now, most people are asymptomatic, but that doesn't mean they aren't still harboring a parasite. It is very common in children, and I'll show you why. It's because it's easily transmitted, and how the eggs are laid, and it is definitely spread more commonly in children. The adults tend to live in the large intestine. Rarely they can live in the appendix or the vagina, but that's, like I said, more rare. I'm going to talk through the life cycle, and then I have a good diagram that we can talk through as well. Okay, so starting with there are adult worms in the intestines, and the female gets fertilized by a male worm from mating. So after mating, females will migrate from the anus to the perianal area at night to lay eggs. And after she lays eggs, she dies. And the male dies after mating. The eggs are now in the perianal region, and they become infective 4 to 6 hours after being laid, which is not very long at all. So in essence, they're almost immediately infective after being passed. So how do you become infected with an egg? Well, you ingest it or you inhale it. So ding, 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 highlight this. This is your infective stage for Enterobius vermicularis. It's the egg that's ingested or inhaled. So anything that's inhaled is very easily transmitted, and that's what makes Enterobius vermicularis the most common helminth, the most common roundworm, is because it's so easily infective. So after you ingest an infective egg, there's a larva that's been developing inside the egg. And it breaks free from the egg, breaks the shell, and is released into the intestines. And in the large intestine, the larva will mature into male or female forms. And then after mating, there will be eggs released from the female. And the cycle continues. It's a fairly straightforward life cycle. You'll see that they get pretty complicated shortly here, but this is very simple egg, larva, adult life cycle. In this blank goes the term retroinfection. So retro, you think backwards. This is when eggs stay in the perianal region. They mature there for, after 4 to 6 hours, and the larvae actually hatch in the perianal region, and they crawl back into the intestines. So this is like the same patient getting infected again by the eggs hatching on their own skin and the larva crawling back inside. So hence the term retroinfection. Okay, here's a good picture of a little boy being infected. So let's start right here, where the gravid worm, the term gravid is a new definition term for you, I'm sure. It means pregnant. So the pregnant or egg-bearing female migrates to the anus, usually at night, because that's when the patient is more still and she has time to lay her eggs and do her thing. So she's migrating to the perianal region and laying eggs. And by eggs, I mean it can be up to like 15,000 eggs that one female worm can lay. So she lays her eggs, and here it's showing that the child is scratching their perianal region. And this is the most common symptom from a pinworm infection. It's called perianal itching, or anal pruritus is the medical term. This is very itchy and irritating. The fact that these little worms are crawling right outside the anus and laying eggs, the patient can feel this and they want to scratch it. And especially in kids, they're contaminating their hands, and then what do kids do all day long? They put their hands in their mouth. So this child is exhibiting an auto-infection. So auto themselves, they're reinfecting themselves with the eggs that were laid. So the eggs become infective again after 4 to 6 hours. And then the larva is now developed and infected inside that egg. So the same child could ingest it, or another family member could ingest it, or anyone else who has contaminated hands or clothing, or it could even be in dust. They would ingest an infective egg. Here's the developing larva inside the egg. So once it's ingested, the larvae hatch out and the larvae mature into male or female forms. And then mating occurs, female lays eggs. So the symptoms are usually asymptomatic. There may be slight loss of appetite, or on rare occasions some abdominal pain, and it's self-limiting. So it's not like this is going to progress to something more major. Although the most common symptom would be the anal pruritus, usually at night. Now, in females, there could also be some UTI complications or vaginal irritation, or in males or females, a bacterial infection from broken skin from all that itching. So any of those secondary complications could occur, but for the most part, these are asymptomatic infections. It is very treatable, and you can get over-the-counter kits to treat pinworm. You might not have noticed them before at the drugstore, but now that you've learned this, you'll probably notice them. And it's suggested that you treat the whole family, because these eggs could be on bed sheets, on clothes, on, like I said, so it's very easily transmitted. So even though other members of the family aren't exhibiting symptoms, you usually just want to treat the whole family, and you repeat it again 2 weeks later. So here's some pictures of over-the-counter kits, medications to treat pinworm. Okay, the diagnosis of Enterobius formicularis involves a unique test called the tape prep test. This is when a piece of cellophane tape, just like Scotch tape, is placed on the perianal region of the patient so that it's literally just picking up any eggs or any adult worms that would be in that area. And that they would be stuck to the sticky side, and all you do is you stick the piece of tape directly onto a slide and look at it under the microscope. There's no staining, there's no concentrating, that we're not dealing with feces here. It's literally just putting a piece of tape to the skin and putting it directly on the slide. So when you're asked for the diagnostic stage of pinworm, it's eggs in the tape prep test. It is usually not eggs and feces, because they're not being shed while the feces is forming. They're being shed externally, so they would not be embedded in the feces. It is possible that you could have eggs and feces, but they would be on the surface of the feces. So that's not what we refer to when we say diagnostic stage, okay? Whenever you're asked, it's the eggs in the cellophane tape prep. So here's an illustration of this. If you couldn't already picture this in your head, you literally just take the patient, put piece of Scotch tape to the perianal region and put it on the slide like I said. This can even be done by the mom at home. They can be instructed how to do this, and she can bring, or the dad, the parent, could bring the tape prep to the lab and we can look at it. Ideally, it's done in the morning while the patient's still pretty still before taking a bath or going to the bathroom or changing their clothes, because that would increase the likelihood that the eggs would be shed, missed. The female worm doesn't migrate every night. So again, back to the specimen collections for parasites, it's not just one sample usually. If one sample is negative, you might do a couple more just to be sure. So what do the eggs look like? They are very obvious once you see enough pictures of these. And this is one that might show up on certification. It's that obvious that techs just, you know Enterobius vermicularis right away when you see it. It's oval, it's pretty clear, and it's slightly flattened on one side. It's got a thick two-walled shell to it, and inside of the egg you might be able to see the embryonated C-shaped larva. So here you can see that the larva is folded up into a C shape inside the egg. So these each have a developing larva inside. And the larva is just a juvenile form of the adult worms. So speaking of the adults, you could see an adult female on the tape prep as well, although it's more common to see the eggs. They are both white or yellowish, the males and the females. The male, you do not need to memorize these sizes, the millimeters or anything, but in general, the male is a little bit smaller than the female. The female has a pointed tail, which resembles a pinhead, hence the common name pinworm. And this is macroscopic. You can see this with the naked eye. And I have 2 slides in the lab that you'll get to look at of a pinworm female adult. And you'd be able to see it on the tip of your finger. It's not microscopic. You'd be able to notice it. One of the samples that I have in the lab is actually a tape prep. It's just it's a piece of Scotch tape with a worm underneath it, and it's attached to a slide, so that's pretty cool. So this is the end of Enterobius vermicularis.